Hi, everyone. Welcome back to Misconceptions, a podcast about perinatal and reproductive mental health. I am excited to have a friend and colleague, Carly Khadesh, join us today. Carly, thank you for making the time in your day to make this happen. I really appreciate it.
Yeah, thanks so much for inviting me. I love doing podcasts.
It's a fun activity, I promise. It really is. So Carly is a therapist, a sex therapist, a licensed clinical social worker, as well as a Mikva director here in Philadelphia. And I'm going to ask if you could give us a little bit more information of your professional kind of trajectory. How'd you end up here? Because I know that you wear many, many different hats. So tell us about yourself.
Hi, thanks so much for having me. My name is Carly Khadesh. I'm a licensed clinical social worker, certified sex therapist, perinatal mental health specialist, as well as the local Mikva director here in Lower Merion, right outside of Philadelphia, Pennsylvania. And so I do a lot of work with Jewish women. I think that that pretty much sums up my job in like three small words, four small words: work with Jewish women. And so I really have found that the work that I do at the mikveh is kind of like an intersection of all of the work that I'm doing in my therapeutic practice, because my clients will share with me information about what worked for them, what didn't work for them, and then I can take that back to the mikveh and expand the role of mikvaos, not just in our community, but also across the country. I've been really fortunate to travel across the country to train mikvaos in different cities, and to make sure that they can be seen as also resource housing for women who are struggling with things like infertility, pregnancy loss, postpartum mental health disorders, and be on the forefront of providing resources and support for women who are coming in with regular stress and not what we would consider not regular stress.
Right. I think that we've identified that the mikvah, while I think back to it as I learned mikvah, before I got married, was very much about a holy and spiritual and hopeful and a place of like kind of rebirth or rejuvenation. And for those people who are not particularly familiar with the mikvah is a ritual bath, something where um men and women go in and out of connecting physically with each other when they're as a married couple, and the mikvah is that transitional space between being separate to being connected and being physically intimate with each other. And so I think the mikvah was always sold as this beautiful, amazing, and special. And then as you get married and you kind of grow up, I guess you might say, you realize that the mikvah can also hold a space of conflict, a space of distress. I think that we want to focus in a little bit about what it means to go to the mikvah when you are dealing with things like infertility and pregnancy loss. So I think that especially when we're talking about a population of people where conception and creating families is which is obviously deeply connected to the mikvah, it doesn't hold a space of joy and pleasure for sure anymore. What are some of the things that you're thinking about? Let's pick one. Let's talk about from an infertility space. What are some of the things you're thinking about when a woman who is struggling with infertility with her husband goes to the mikvah? What are some of the things you're hearing?
So I think the first thing is the frequency in which this mitzvah is kind of feels like it intensely interferes with the way that they live and with their relationship. So I think that college teachers overall, there's been much more of a push to educate about things like infertility and pregnancy loss during college classes, which are the premarital education classes that Orthodox women take before they get married, to learn about all of the Jewish laws and structures related to mikvah, and the laws of family purity, or taharas mishpacha, which is the Hebrew phrase for that. And so the way that it's kind of been taught historically is like, oh, but once you get pregnant, you're going to spend 10 months and you're not going to go to the mikvah. And so, like you might need to relearn these halachos. And like, I'll self-disclose, we did fertility treatment for 4 years before I had my oldest child. I have four children now, which is really miraculous. And I'm so grateful. So I like to share my gratitude. But I remember I was sitting at a wedding with a friend of mine, and this instrumental music started during the meal, and I was like married. I think I'd been married for like, I was pregnant at the time. I was married for like 4.5 years. And I turned to my friend who was sitting next to me. She had been married for like 2 years, and she already had a baby. She's feeding the baby by spoon at the table. And I turned to her, I started laughing. I was like, this is the first time. I haven't heard this song in like 6 months. And she was like, what are you talking about? And I was like, this is the music that they play at the mikvah. And she was like, oh, Carly, I've been to the mikvah twice since I've been married. And she had been married for 2 years. And here I am. I'm like, I have this long history. It was the first time I realized how intrusive and how relevant the laws of going to the mikveh, the laws of family purity, all of the minute structures that we have in place, like doing badikas, hefsek tahara, like how much more experience someone who is struggling with infertility has and is practiced at keeping those laws. And then because of that, there's such an increased level of awareness of their status as someone without children. And so there's like the physical reality of like, well, I need to rearrange my life around my monthly cycle. And then once you add in the treatments, it's like I have to rearrange my life even more because I have to go for monitoring ultrasounds. I have to go for, I have to give myself injections on a daily basis. I have to go for blood work 4 times a week. And, and so and then on top of that, there's like the Jewish law that you have to include on top of all of that. And so I think that can amplify the amount of stress that fertility treatment causes for a lot of people, because there's like this acute awareness and there's no respite from it because it's in every single area of life. And so that's the first thing that I think of. I mean, there's more, obviously. I think there's also like a hyper awareness of and fear that like the mikvah attendant or the mikvah lady is going to recognize me. She's going to know. What if she says something like, "Oh, I was hoping not to see you again," which she should never
Yeah.
say. And if any mikvah attendant ever says anything like that to you, you should report it immediately to the person who's in charge of your mikvah so that they can address it. And so I think that there's just like this hyper awareness, which really, like from a mental health perspective, that's hypervigilance. That's a sign of trauma, trauma with a little t, right? It's not what we typically think of when we think of trauma, but it is, I think, experienced as traumatic.
Absolutely. And I think, one of the things I think about also is like the that joy that, oh, this is supposed to be so beautiful and amazing, can really get lost very, very quickly. It was really fascinating. I once heard from a college teacher who was making a recommendation for someone who was going through fertility treatments for many, 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 many years. And she actually was recommending that they consider going on birth control for a few months to stop her period for several months, just so she could have reprieve from having to go to the mikveh every single month. It was an interesting recommendation. I've heard of couples choosing to do that just to give themselves some kind of breath from that every single week, every single month thinking about these things. You use the term intrusive. You said this, it can be very intrusive. I think we need to explore that, because I think that when, some people who maybe are a little bit, maybe you and I are perhaps a little bit jaded because of the types of people and stories that we hear, but I can imagine that there are those that will hear this and say, like, how dare you say that this is an intrusive obligation or intrusive mitzvah? Especially because it really is a center point of our world as a religious couple. So talk to me a little bit more about the word intrusive.
So I think that it's very deeply personal. I think that everyone is going to have a different relationship with mikvah, not just on their own individual level, but I think every month is going to be a completely different experience based on where that person is in their fertility journey, where that person is in their religious journey, where that person is in their relational journey, and any external stressors that may increase, right? I use the word intrusive because I think Taharas Mishpacha, I actually did a podcast with the Kala Teacher podcast where I talked about mindfulness in Taharas Mishpacha. And it's one of those mitzvahs where there is such a intense shift in behaviors based on where a woman is in her monthly cycle. So when a woman makes the transition from tahor to nido and her period starts, we refrain from certain behaviors. We increase other behaviors. We're very mindful about our own status, right? Like we set our table differently. We rearrange the furniture in our bedrooms differently. We make a lot of accommodations so that we don't forget what status we have in that moment. And I think there's a lot of effort that needs to be put in on the other side once the transition happens from nida to tahara, to also match that level of mindfulness on the other side. And I think that that's something that can be reinforced by college teachers. I think that it's not always something that is reinforced, but I think that most couples benefit from having increased mindfulness. But I think because we have such intensity in the shifting of our behaviors, that can be experienced as intrusive for someone who doesn't want to make that shift. They would much rather be pregnant. They would much rather not have this status. And it kind of feels like it's something that I mean, they have no agency over it. They have no choice over it. They're doing everything that they can to not have this be their reality. And then it ends up being their reality anyway. And there's so much loss in that. And I think the loss is the part that's intrusive. And I think that it's the observance of the nuances of the halacha that sometimes get the resentment like pushed out on them, right? Like it's the projection of that resentment and of that loss. But that's not to say that it's not, still Torah and it's not still a mitzvah and you're still scarring it even if you're not happy about doing it, right? Like, and so yeah, that's kind of why I use the word intrusive.
I think it really speaks to this idea of how it may feel for those that are going through it. That idea of this feels like I don't want to be doing this right now, not because I don't want to do this because of my religious obligation, but because I shouldn't be doing it this frequently, this many months in a row, because I should, noticing those words, I should be pregnant or I should not have been in the state of miscarriage. Like I had so many bigger plans, so much of bigger story that I wanted to live. And I'm stuck in this cycling of in and out of the mikvah, and it can feel incredibly exhausting. I don't want to miss the opportunity to talk a little bit about that mindfulness component because you put it out there, and I think I've heard you speak about this before, and I would love for you to explore this a little bit more here. This idea of when we return to that better state of being connected physically and intimately with the spouse, what does it mean to be more mindful, that reconnection? What does that mindfulness actually look like?
Yeah, so I think that the first piece is kind of like a cognitive or thinking shift where we tend to think of like the times of Tahara, the times of physical connection as like the default, and Nida is like the exception. The time of physical withholding is like the exception to the default or the opposite of the default. And I think that if we look at them more like equal level playing field, where both of them are the default, both of them are normal, both of them are regular parts of a life cycle for a woman who still has a monthly cycle, then there's the opportunity to equalize them. And I actually think that there's a tremendous amount of chachma in that the wisdom, in that the mindfulness tenets, which are not, they're not called mindfulness, it's the harchakos. I'm reframing the harchakos, which is the laws that create the rules around how the level of distance between a husband and wife during the time of nida. I'm reframing those as a form of mindfulness. And I think there's a tremendous amount of chachma or wisdom in that those are given to us for nida because it doesn't feel natural to withhold. Where it's supposed to, right? I'm using those words very intentionally because it doesn't always feel like it does. It's supposed to feel more natural, and but because we have this constant back and forth and constant renegotiating of nida tahara, I think that it's very personal for each couple for how to reinforce that mindfulness during times of physical connection. So, whatever that looks like for a couple is going to vary depending on their level of physical comfort with one another, depending on their level of comfort being, touching each other in front of their children, if they're going to give each other a kiss on the cheek before one of them leaves for work or one of them leaves to go to school or drive carpool, whatever it is. But I think creating kind of a framework for intentionality in physical connection. And I'm not even talking about physical connection in sex. I'm talking about physical connection just in general, because it can be really difficult to make that transition. And I think, especially for people who are experiencing pregnancy loss, especially for people who are experiencing infertility, that transitional space can be very difficult. And building in opportunities for mindfulness can be really helpful. So one of the things that I work with my clients around is creating a framework for this with like what we call touch points, like what feels most accessible for both of you based on the schedule that you have and the routine that you have in your life. So is it possible to have like a 30-second hug before you leave for the day, before you, depart from each other in the morning? And then can you do the same thing before bed to kind of create like a bookend where there's an intentionality in physical touching, totally separate from anything sexual?
Hmm. So if we're thinking about a couple, let's say, for example, who are dealing with infertility in particular, and we know that they're coming home from the mikvah, coming back into that state of connectedness, can also have a lot of distress associated with. Like it could be hopeful. Maybe this month I'll get pregnant. Maybe this month we have a transfer, for IVF within the next several days. There's a hopefulness that could show up, but there can also be a level of like, here we go again, maybe this time. And I'm wondering what are some of the intentional components that you might offer as a therapist and as a sex therapist? What are some of the intentional components that we might offer a couple who are returning to each other, but who are also struggling with infertility. I think about it not just from like, as they resume their physical connection, but also coming home from mikvah itself, that actual, kind of walk back to the car, back to your homes. What does that look like if we were to do it more mindfully? What might that look like for those clients or the people we work with?
Yeah, so I really like using narratives in this way where a client can create some sort of like self talk or affirmations or visualization exercise where they can envision entering a space of holding with their spouse and whatever that looks like, right? Like, I don't want to define it because I think that it's so deeply personal for every couple. So I don't want to create one, in this space here, but I think that whatever that looks like. And then I think that creating a transitional space. So, if it's possible to take a walk together before you re enter your house, can you spend time together outside of your bedroom so that there's less pressure put on this physical reunion? Can you put on music that both of you like? Not dissimilar to like, when I have a really difficult session with a couple client and they're like at each other's throats the whole session, we'll spend the last like 5 minutes triaging, right? And then I'll say to both of them, is there a song that you both love singing out loud to? And then usually they laugh, they identify a song, and then I'm like, okay, when we hang up or when you leave and you go get in your car, can you put that song on and just sing it together? So that way you're not continuing the dynamic that happened in this space, in the space that you're going to, because you need a break. Like you deserve respite. And I think that the creation of those transitional spaces is where that respite can be joined in, especially in the transition from Nida to Tahara after Mikvah. And so it might be deeply personal. Maybe somebody would benefit from one themselves, right? You have a client who walks around CVS and buys herself a new lipstick, right? I
New
never
lipstick, exactly.
Right, I never forgot that story. So maybe, that might be deeply personal. You might benefit from doing something yourself. And then in addition to that, doing something with your spouse. That's, like go in your car, put on heavy metal music, bang your head, like whatever you need to do to kind of get out of the intensity of that space and then to be able to transition into a space that you can share with somebody else.
Because I think this is an acknowledgement that mikvah can be very intense. The intensity of mikvah and also the intensity of the separation may not be matched with a heightened, beautiful intensity of reconnection. It may not be on the same level in that way at all, especially when it's so heavily laden. What are some things that you think about when they're actually walk? I love this, the mindful approach and really attending to self as well as attending to the couple. Are there other things that you think about when transitioning back to physical connection when you are dealing with a couple that are dealing with infertility and they're coming home from mikvah, like
Yeah, so
specifically that transition?
I would even like back up and say, well, let's talk about mikvah itself, right? So if someone calls me as a mikvah director and discloses, I haven't shared this with many people, but we're actually doing IVF and I'm not sure of the timing, right? Like these are phone calls that I get frequently because sometimes the timing has to shift based on when the transfer is scheduled and or there's a heter for, like for a daytime tefillah or all of those things all of those things are applicable here. And so um, one of the things that we'll do is we'll offer the Kala suite for somebody who's going through fertility treatment. And it's an offer. It's not, you don't have to accept it. It's not like, we're not putting a note in your file. It's, we're going to say that you're going to get assigned to room 10, which is our Kala suite. And that is so that, maybe there's like a semblance of self-care and you can utilize the big jacuzzi tub and try to connect to yourself. The process of preparing for mikveh is so bodily focused, which also adds to this intensity because you have to have so much awareness of what's going on your body, what every step is related to a different part of your body. So I actually wrote like a visualization for mikvah preparation. I'm happy to send it to you. You can share it as a resource that is really like somatic focus to try to say like, I am in charge of this process. I have a voice in this process. This isn't something that's happening to me. I'm in control and I'm doing this. And then going in the mikveh and immersing is also a completely somatic experience. And so being able to use mindfulness and visualization in that is also a very powerful experience. And then I totally forget what your original question was
That's okay.
about.
I just thinking about, well, I think about like the tips about transitioning from mikvah home. But before I do that, I want to capitalize on that comment about this idea of it being such a somatic and bodily focused experience, especially with an individual who's suffering or struggling through infertility. So much of the infertility experience is bodily focused, right? I mean, there's no way around it. It's happening inside of her or
I
their body, right?
I think pregnancy loss as well, like there
Absolutely.
it feels like for a lot of people that this was a massive betrayal of my body. My body let me down.
Exactly.
Now all of the sudden I'm thrown in and I have to participate in this deeply physical mitzvah. And I have to look at all these mirrors and I have to have all these reminders of why I'm here. And that can be very, very untenable almost for a lot of people. Yeah.
Absolutely. I think that's a very valuable piece. And that's not even giving any consideration to things like, people who struggle with eating disorders or body image dysmorphia or things like that. It's really body dysmorphia. It's more a matter of like, these are just some of the realities of going to mikvah. Does the process itself is one of putting a heavily emphasis on the body of looking at our bodies and being mindful about ourselves and our bodies. And yet that hyper awareness is so prevalent in that infertility space that it's compounded in that experience. So
Yeah.
in moving a person home from mikvah to the house, and to their spaces, in addition to taking a moment for self, taking a moment with each other, anything else that's coming to mind in terms of just kind of a mindset towards the reconnection time?
So I think intentionality is the big key, right? Like that, I use that word a lot. So I think remembering the big picture, which is like there's the short term goal, which is what you're engaged in on a regular basis, which is to build a family, and that's both a short term and a long term goal. And then there's also this very big macro goal of like you're returning to this person that you feel very strong feelings about, you love them, you want to build a connection with them, and being able to engage in whatever physical contact feels comfortable for both of you. I think open communication is really important. So I would say, we have the intentionality and then we have the communication about expectations, about, I'm not sure that I'm going to be able to be fully intimate because I'm just feeling really uneasy about everything that's going on. Right. And some of that may be out of someone's control too, because if someone just had a transfer right before they got to the mikvah, they might not be allowed to be physically intimate depending on where they are in their cycle. And so I think that there's definitely nuances there that need to be negotiated, and that's best done with open and honest communication. And then I think also there's differentiation. So those would be my 3 points. There was the intentionality, communication, and differentiation. And the differentiation is differentiating physical affection and physical intimacy from the act of sex, that there is so much value in sharing a physical space with someone that you love and care about without sex. And both of those things are equally, like they're on the same level. And I think what happens is, unfortunately, for people who experience trauma, for people who struggle with a positive relationship with sex, for people who struggle with sex in general, there's this phenomenon where if sex isn't happening, there's no physical contact happening at all. And
Right.
so I think that the differentiation in that is really, really powerful and can help create a positive environment, a positive context within a relationship where the physical relationship is still being nurtured even when sex is off the table.
And I think I want to differentiate. I want to be specific in terms of saying what is the idea of physical touch or physical connection, right? So I want to be clear that what Carly is saying is not exclusively, intimate kind of touch versus sex. It's touch in general, that connection, that physical touch and connection. There's studies that showed like it, increases our dopamine levels, it decreases our anxiety levels, it makes us feel more stable in the world when we have a physical connection to a person who we care about or who cares about us. And so valuing physical touch and physical connection is something that is it should be something that's like a tenet of a relationship. Like it should be a framework within a marriage. I want to always acknowledge as well that there are those communities that are not comfortable with many different kinds of physical touch outside of the bedroom. And so even if it's non-intimate physical touch, there may not be there are certain communities within the Orthodox faith and culture which would limit that kind of physical touching. And I would suggest that therefore you have to move some of that physical touch into the bedroom, but that doesn't mean that it has to be intimate touch. It can be connecting and affirming and a touch that makes you feel safe. And I think that that's a very important thing to highlight. And as we discuss these kinds of relationships, differentiating between the different kinds of touch and each of them holding their own value.
Yeah, and I think that if the bedroom is something that is only experienced as a sexual space and there's a need to increase that non-sexual physical touch, there are environmental changes that can be made. So can you, use a different blanket on the bed? Can you sit in a different space? Is there a seating area in your bedroom where you can sit together, sit closely to one another, and try to make some environmental changes to shift that. If being in the sexual space is too difficult, there are ways to help work with, and also there's always value in working with a sexual health professional to try to help negotiate and navigate some of this, and a RUV, right? So if it's possible to ask, can we hold hands in the car, right? Can that be a transitional space? Or can we sit, if no one's in the house, can we sit on the sofa, not near any windows, and make sure that you're asking the questions that need to be asked. And I like to frame asking a RUV, you're asking for support more than you're asking for permission. And if you go and you ask with and say, I'm asking for support, I need help with this, very frequently there is halachic framework and leeway to get the support that you need.
Especially because many of these things are not halachically based. Like many of these things are just community custom,
Correct.
but which we honor and respect that. But also recognizing that when there is some change, something that is out of the norm, the fact that they are dealing with infertility or pregnancy loss, or whatever they're dealing with from a reproductive health perspective, making sure that they know that there are resources that are out there that are going to be supportive. I think that these are incredibly valuable components of this conversation is also this question around communication. And I love it because they say, you have to have good communication skills. And I'm like, and I'll meet people again and again, and you will meet people again and again, and you're like, they have no communication skills. They have no idea what to do. Right. And we probably had to build our own communication skills as we became partnered and began to develop our own relationships in our marriages. And I probably still think that I continue to work on to this day of building a strong and healthy communication. I think that when I think about it, I don't want to break it down to like the top three things you would recommend for good communication, but I think that we also can't just throw it out there and just be like, we have to have better communication, because I don't think everybody knows what that means. And especially if they haven't been trained as a therapist and we don't have skills training in couples counseling, when you say we need to improve communication, so much of this is about communication. Break it down for the people listening. Break it down for somebody who might be going, well, I don't really know, or I'm not exactly sure what good, healthy communication really means in this space.
Yeah, so I think that it means a lot of practice. I think that's the first thing, is people are afraid to practice and people are afraid to get it wrong. I always think back to this one session that I had with this couple. They were very, very newly together, and they were very cute. And they had just gotten into a very large fight, and the husband hurt the wife's feelings. And this to her was like an emergency. And they called me, they came into my office. They had actually discharged about 6 months ago. They were doing really well. They came into my office, and the wife is like, he hurt my feelings. And I was like, did you know that you hurt her feelings? And he was like, yeah. And I was like, can you explain why you hurt her feelings? He was like, well, there was something that was happening that was really upsetting me, and I needed to bring it to her attention, even though it was going to hurt her feelings. And I was like, yeah, that makes a lot of sense. Can you hear that? Can you hear that this was not just your and she was like, "Oh, I need to be able to take care of my own feelings so that I can hear what he's saying." And it ended up being a very productive conversation. But they needed practice, right? They needed practice at being able to take care of their own feelings. I think that for a lot of newly married people, there are conversations that you realize that will be happening in marriage that, like, you could never imagine ever having this conversation with the person that you're
Right.
going to be married with, right? Like, even if you think about something like gastrointestinal upset, right? Like the idea that you would be sharing, like, oh, I have really bad gas pain with your spouse when you're like newly married for a month, sounds like the most cringy conversation that you could ever be having. And then eventually those conversations become normal, and maybe even become, there's a comfort level around them. And then I think that, and then they even become intimate conversations, right? Like, so I think that the first thing is practice. Like, sometimes you just have to say the thing even though it feels really, really, really hard, and then you both have to deal with the fallout of saying the thing. Obviously, being mindful, you don't want to be intentionally hurtful, and you don't want to be blaming and not, name calling, or this is all within the construct of what is considered like healthy and respectful dialogue between two people that care about each other. And I think that the other piece of it is the timing, right? Like, you want to be mindful of when is this conversation. And sometimes you want to ask, when is it a good time for us to have a conversation about the mikvah? Because I need to go on, Tuesday night, and I want to make sure that we can talk about what the expectations should be when I get home, right? So you're asking permission. And then, maybe that your husband would be like, "Yeah, let's talk right now." And you're like, "Yeah, but you're like you have a work phone call in 3 minutes and I have to run out the door, and like I'm feeling really flustered. I need to think about how I want to present this, and then we can talk about it another time." And then make an appointment and talk about it with one another. And then give also that space to transition in and out of those hard conversations. So I think having ground rules and boundaries is a really good practice. My recommendation is don't have arguments in your bedroom. I think that it's just very good practice. Sit at the dining room table, sit at the kitchen table if you have one, sit on the sofa, sit outside if you can, but like don't try not to have arguments in your bedroom. Obviously, sometimes it's unavoidable, but that I think that figuring out where your boundaries are in that, being able to honor them, prepare, ask consent before you have a difficult conversation. Don't blindside one another, and then practice as much as you possibly can.
I'm thinking about when you talk about idea of like I want to talk to you about it, how I'm feeling or plans or expectations about going to mikvah when dealing with something like pregnancy loss or infertility. I think one of the things that I think is so valuable and necessary is to be able to communicate to your spouse um, really what you mean versus what you just the words that come out of your mouth. So, for example, what I see is somebody will say something like, I don't even want to go. Like, I don't even feel like going. And I think we have to be honest that that can feel like a tremendous rejection to the person who's waiting for you to come home. And I think that, not because, oh my gosh, we have to be intimate and we have to have sex, but more like, I care about this person. I love this person. I miss this person. And so when a woman says, I don't even want to go, it can it can communicate a rejection that she probably didn't mean. And instead to be able to say, worried about going, I'm nervous about going, makes me so anxious. I just feel so sad that I have to go again, and therefore, let's talk about ways for us to like kind of just ease that transition home. That sounds very, very different than I just don't want to go, right? Or I'm dreading going because I have seen where the male takes that in as rejection of self versus I want to go, I miss you, but there's a lot of complex feelings that are coming up, and there are a lot of complex feelings that are coming up for me by having to go to the mikvah again, and maybe we can strategize some ways to make it better. What do you think about something like that?
Yeah, I think that it goes both ways, right? Like I think that there is validity and there can be permissiveness to be able to say in a relationship, I don't even want to go, right? Like I think that that can be met with compassion. And I think there's a way to say it where it's clear that it's not a rejection, right? Like if I were to say, like, this is about me, this has nothing to do with you, right? I'm so, like a hug is going to feel so comforting to me right now, but I
Right.
just wish I didn't have to go to the mikvah to get one, right? Like I think
Yep.
that there's a way to communicate that where it's relational instead
Right.
of it being just about me. And I think that's the challenge of being married. And sometimes that's amplified by going through fertility treatment because frequently it is the woman that is experiencing all of the medical interventions. And so a lot of it feels like this is all on me. This is all on me. This isn't a shared responsibility. And so I think that there sometimes is a tendency to think in those terms and to speak in those terms as it's all about me. And sometimes it requires a little bit of effort to remember there's somebody else that's also experiencing this loss. There's somebody else that is also experiencing the fluctuation between nida and tahara and the withholding and then the transition to the physical space. And that's hard for everybody. It's difficult for everyone to navigate. And I think asking, like, is this something that's going to build, is this something that's going to increase our connection if you're unsure about something that you're going to say, and then answer really honestly, like, is this something that's going to hurt our connection, or is this something that's going to increase our connection or my spouse's understanding of me?
Right, right. And I think what you just highlighted is also something very crucial, this idea of like not making assumptions about what each person is going to be feeling or experiencing. And I think sometimes we have that assumption of like men like this and women like that. And it's not true, especially in the work that we do. We've really learned significant differences in and differentiations in how people experience intimacy and communication and touch and things like that. And we are seeing the same exact thing when working with somebody who's dealing with infertility. And so she's not only the identified patient, she's also the one who has to go to the mikvah. So there's a tremendous amount of responsibility on her. And I think about when a woman is able to communicate the pressure and communicate how that feels and communicate maybe some hopefulness about coming back, the I'd like to believe that in a healthy relationship that they can be met with that level of compassion, connection, but also acknowledging that it may also be hard for him, that we can be dealing with performance anxiety, pressure. Like, I also don't feel like being in this space again, right? I'm dealing with a wife and I'm dealing with my own emotions and I'm dealing with a lot of feelings. And I think acknowledging both experiences.
Right, or a tremendous amount of guilt, right? Like if the reason that she needs to do IVF is because he
Of male factor. Yeah.
has no factor infertility, then he may feel incredibly guilty that he's
Yeah.
the one who put this on their situation, right? Like this
Yeah.
is and there's feelings of like internalize, what does masculinity mean? What does femininity mean? Like there's a lot to explore
Oh,
there.
yeah. Oh,
Yeah.
yeah.
And yeah, I think that the mikvah is a transitional space, right? That's one of the things that's so beautiful about the mikvah is that it is this transitional space, and also so challenging about the mikvah because transitions are really hard. Like
Yeah.
they're difficult spaces to be in, and they're also really hopeful spaces to be in. And so, yeah,
Yeah.
it's a really deeply personal experience for every individual and every couple.
So let me ask you, Carly, what are some of, let's say, the top two or three misconceptions that you wish people understood about the mikvah experience or the transition of the mikvah?
For people going through infertility or in general.
Yeah, both.
So I think the first thing is that the mikvah is there as a resource. I think that's a tremendous misconception. I think people think that they need to just show up and do the mitzvah and then leave, right? And I think that a lot of people don't ask, they don't disclose, they don't share. And if people take one thing away from this podcast, it is please like figure out what you're comfortable sharing, share it, and ask for the accommodations that you need because mikvahs are really places that want to be accommodating, they want to be sensitive, and they want to provide a level of support for the women going to the mikvah. So that would be like the number one misconception. The number two misconception is that it's not always this beautiful, spiritual, holy feeling experience, right? Like I like to compare the mitzvah of mikvah to like lighting Shabbos candles, right? Sometimes you light Shabbos candles or going to the kosel, right? Sometimes you light Shabbos candles and like the table's set and your house is ready, and this never happens to me.
Yeah, I was
And
going to say, really?
yeah, calm, and the tears just start flowing, and then you feel like there's a direct channel opening to Hashem, right? And you dive in from your heart, and you feel this intense connection and spirituality, and it's this really beautiful experience. And sometimes the house is a complete wreck, and like you're not even sure if the lights are on or off in your bedroom, and you're still in your bathrobe because you just ran out of the shower, and there's no tablecloth on the table, and all the papers from the week are still on the table, and there's a million things that you have to do, but like it is the 18th minute. And if you don't light Shabbos candles right this second, you are going to be missing Shabbos and lighting an extra candle for the rest of your life for the wrong reason, right? Like, so, like sometimes that's what mikvah is like too. Sometimes it's this beautiful spiritual experience and you feel like there's a direct channel to Hashem. And sometimes you're like, okay, the water was warm, right? And so the goal is like, I think there's a lot of pressure from mikvah attendants and societal pressure and cultural pressure for mikvah to be this deep, meaningful, beautiful, positive experience. And from my perspective, like positivity would be great. Like that's awesome. That's a great thing to try to strive for. But like, let's strive for neutrality, right? Like, let's make mikvah a really neutral experience where you feel safe. And
Yeah.
so I think like that is also a major misconception that I would say. And then yeah, I mean I think those two pretty much cover it. Yeah.
That's great. That's great. This was a great conversation. I really appreciate the time that we spent together. There probably will have to be a part two, but for today, thank you so much, Carly, for making the time to talk to me. And
It's
this was
my
great.
pleasure. Yeah.